Is severe lower back pain threatening to ruin your upcoming vacation? This video is perfect for you. Hi, I'm Dr. Molly with Your Goals Physical Therapy, and I help active adults overcome their aches and pains to keep them doing their favorite activities without pain medication, injections, or surgery. And in this video, we're going to talk about Tom. Tom woke up with severe lower back pain. And it could not have come at a more inopportune time because he had been planning 4 months an amazing hiking trip in Africa. And so with long walks in airports, the long travel hours, and then the actual vacation being about hiking, he was freaking out that he was going to have to cancel the vacation, and worse, he thought he was going to have his third lower back surgery. So in this video, we're going to talk about how he went from that horrible moment to fully enjoying his vacation and having no surgery. Tom is in his early 60s and he loves to travel. He takes photos and he's taken beautiful pictures all over the country. And he plans these large trips with other groups. And in this case, the trip was going to Africa. And this trip had been on the books for months. And because of his history with lower back problems, he's had 2 surgeries, one of which was a fusion, one of which was a laminectomy. Fusion helps, it joins 2 bones together to help it improve its stability. And a laminectomy helps open up the joint space. So your nerve goes through a hole and sometimes that hole shrinks. So they go in and open that hole again. They basically just drill out some bone. That's what a laminectomy does. But when you've had a history of 2 back surgeries, you just don't want to have another one. And so back health is his number 1 priority. And because of that, he has changed a lot about his lifestyle. He has a trainer that he works with on a regular basis, and his wife and he go on walks at least 3 times a week, and they walk 2 miles in the morning and 2 miles in the evening when they get those walks in, which is amazing. All good things for his back. And so when he called me, he says he woke up with severe lower back pain. His wife had to help him get out of bed. But once he was up, he was like, oh, okay, maybe this is good. And he walked around for a little bit and it was all right. But over the course of that day, what he discovered was that he couldn't sit in his office chair for longer than 30 minutes. That aching became too severe, and it was almost worse as he was trying to get up, but at least it would subside for a while once he was up standing. But he could not stand still, so he couldn't do office work just standing because the back pain would become too severe there as well, but only after 2 or 3 minutes. He was okay walking. It would start off uncomfortable, but it would be good for a little bit, and then it would just be excruciating. And so he wasn't able to complete the walks with his wife. Not only is that, the not being able to complete the walks with his wife devastating because it was part of his workout routine, that's their time to talk. It's their time to socialize with their neighbors. So this back pain was just wrecking a lot of things for him. He couldn't work. Couldn't hang out with his wife and do the things that they usually do, and now it's going to take away a vacation. He went ahead and called the surgeon because he was certain he was going to need MRI and possibly an injection, and he wanted to go ahead and get that ball rolling. But like I said, he called me relatively early, and so this is all the story that he's telling me. So I was getting there before he had seen his surgeon again. So we're poking around and trying to figure out where the pain is coming from. I check out how his spine is moving. We look at how well his hips are moving, check out some strength. I watch him walk, look at his overall posture. And what we figured out was that the severe pain going across his lower back did not go down his leg. Nothing actually made anything go down his leg, which was good news, because if pain goes down your leg, it means a nerve is being pinched. So just having the pain in his lower back and being able to press on it, and that got very tender too, told me that we were dealing with two isolated points of irritation. Now the question is, why are they irritated? So here comes a bit of an anatomy lesson. I will bring my skeleton up here. Okay, so in your hips and lower back, you have, you have your sacrum, and this is your sits bone, right, or your coccyx. It attaches to your hip bones, and there are two joints here that on Tom were severely inflamed. Then you have your lumbar spine, and for Tom, these two joints just don't move. And so the joints below and above are supposed to move even a little bit more, but on him, nothing was moving. This whole thing was completely locked out, and these two joints here, where the hips attached to your sacrum, were moving way too much. So I was like, well, I think we figured out the cause of your discomfort. These 2 points are severely inflamed. And so we talked about icing. I talked about how to stabilize those joints while he's doing his everyday activities to allow the joint to relax and heal and let some of the fluid leave. When we finished up the eval, I gave him a couple things that he could do, and I had already done some manual stuff to see if that would calm it down. The next time I saw him, he was amazed. He was like, I was a little sore that night, but when I woke up the next morning, 80% of my pain was gone. He's like, I'm not canceling the surgeon yet because I want to see how this goes over the next couple weeks, but I'm very hopeful now. And a huge weight came off because he was able to sit longer at work. He was able to he could go about halfway on the walk with his wife. And so he saw an amazing transformation, and it decreased the amount of worry and anxiety he had dramatically. So we continued to work on a few things, isolating muscle groups to make sure things were working correctly. I talked to him about how to modify what he was working with his trainer, so he didn't have to just stop doing other things that he was doing with his trainer. And over the next couple of weeks, all of his pain subsided. And that couldn't have come at a better time, because by the time all the pain had subsided, he was getting ready to still pack and do some other things for his trip. And so he was like, this is great. I can continue doing all these things and I can go on my trip. And so we talked about how to, what happens if there's a flare up. So I gave him an action plan for that and things that he can do to stabilize and stretch if he ends up with a flare up on his vacation. But I was very thankful because when he came back, he told me that he had no pain. He never had any inkling of problem, and he fully enjoyed that amazing vacation. I got to see the most beautiful pictures from Africa, some amazing animals there that you don't get to see anywhere else, and Tom was over the moon. And so he is fully back to walking his 4 miles a day with his wife, and he is enjoying life with his trainer. His trainer was also very thankful because he's back working with him full time. So all's well that ends well. Now, if this is the type of service that you're looking for, but you have some questions about your specific situation, because back pain it's all different for everybody, and it can be very overwhelming, and reading stuff on the internet and all the different advice you get from friends, sometimes it's a little too much to process and deal with. So if you have questions that you would like to ask before committing to an appointment, then you're going to click the button below that says talk to a PT. You'll fill out a quick form, and it's basically just a generalized what you'd like to be talking about on the call, and then what time would be good for us to call you back. If you are a little bit before that and you want to find things that you can do right now to help your lower back pain, I have put together some of my best tips on how to treat back pain, even starting at home. Some things that you can do right now at your house to help you out. And I put those in an electronic book or an ebook. And so if you click the button below that says get my tips and fill out a quick form, you just check your inbox and that book will be waiting for you. So until we have an opportunity to meet, I hope that you're having a great day, and I'll talk to you soon. Bye.